Hello, I'm Kate Weller. Today I'm going to do a video on a blood smear for the VET 403 in clinical pathology procedures. To begin with, to basically proceed in doing a smear, the equipment you'll need are glass slides. You'll need a fresh sample of blood, which is collected into an EDTA tube, which is the purple top tube, which has an anticoagulant in it to prevent the blood sample from clotting. You'll need a pen to label your slide with the name of the patient, the date, and the type of procedure or sample that you're having on the slide. You'll need a pipette. The pipette is to draw up the blood. You can ideally use a capillary tube as well to get a small sample. Some forceps to hold the glass slide when you're putting it into the solutions. And then you've got the stains, which is the Romanowski stains are what they're called. So you've got the fixative dip, dip 1, which is a red solution, which is the Icin solution, and the methylene blue, which is a purple solution. So firstly, you'll take the sample of your blood and just remove the lid. And you want to take a very small amount of the blood. That's where the capillary tubes come in handy. Just place your blood sample in it. And you want to pop a drop of blood onto the end, either end of the slide, like so. And then with another slide, you use as your spreader slide. So you're going to place it just in front of the drop of blood, about 25 to 45 degree angle, and you're going to draw backwards into your drop of blood until it covers the entire slide there, and then pushing forward. You're going to, ideally you want to have an even coverage of the blood on the glass, and not too thick, not too thin, and has to have a feathered edge, and ideally no streaking as well. From here, you'll take your sample, and it needs to be heat dried with your hair dryer for about 20 seconds. So your sample is dry. And then you come back over to your Romanowski stains. So into the fixative first, so your pale blue fixative. You can also use your forceps here. Ideally, if you didn't have any gloves, you can use these to hold on to, so you're not putting your fingers into the and getting stained. So about 5 to 7 seconds into the fixative. And then with your excess runoff, you're just wiping it on your canister there. And then into the second solution, which is the Icin solution, which is the red one. Again for 5 to 7 seconds in there. And again removing that runoff onto the side. And then lastly into your second dip, which is the methylene blue, which is a purple solution. And just getting that runoff. Once you've finished there, just need to run under a very light stream of water the slide. Ideally you'll use distilled water. Then you take your slide, and with either with a lint-free towel or tissue, or the Kimi wipes, just blotch your sample. And once your slide's finished, it can be popped aside for the vet to view under the microscope. And ideally what they're looking for is the differential white blood cell count or any abnormalities in the cells, which is usually can be sent away to an external lab or just viewed internally under the microscope. Once the slide is dry, you use your pencil and then you can label your slide with the animal's name and the date. And if you were to send it off to the external lab, there's little canisters that you can put your labeled slides into for transportation without getting any damages or any ruining the slide on the transport to the external lab. And that's how you do a slide.